I'm the Equality Advisor with Concern Worldwide, which is an international humanitarian organization working in 23 countries in Africa, Asia, the Middle East and Caribbean. Our vision, our mission and our work are all defined by one goal: ending extreme poverty, whatever it takes. And we believe that no one should have to live in fear they won't have a home to sleep in or enough food to feed their children. And when we're talking about fear and school-related GBV, the reality is that gender-based violence is impacting millions of children around the world. WHO estimates that 150 million girls and 73 million boys have experienced sexual violence. In some countries, more than 80% of students suffer corporal punishment, which impacts on their ability to learn, their attendance, their retention and completion, and their health and well-being. So it's really simple. If we don't address gender-based violence within our education programs, the money, the time we spend with children and in schools becomes less effective, and essentially we'll not be changing behaviours. So today we're looking at how Concern is addressing school-related gender-based violence through the Safe Learning model, which is part of a randomised controlled trial, so that we can see if the approach is working. So it's really interesting as it focuses on, access, quality and well-being within the school, but reaches beyond into children's homes and the wider community. In terms of the session, just to give you an overview of the session, we look at the context of Sierra Leone and the challenges within the education sector. We'll get an overview of the Safe Learning model and the gender transformative approaches that are in the approach, and look at some of the findings from the randomised control trial so far, and it's time for some Q&A. We have great speakers here today, and hopefully we have Abu Bakar Karoma, the Programme Coordinator from Concern Sierra Leone, Impoma Bena from Sonke Gender Justice, and Shawneen Sloan from the University College Dublin. So I'm going to hand over to hopefully Abu Bakar, if you're with us, to talk about the programme.
Thank you, Bernadette.
Great. Great to hear you.
Good morning, good afternoon, good evening, from wherever you are. So I'm Abu Bakar from Sierra Leone. So as you've heard, my task is to share with you how the Safe Learning model is holistically addressing school-related gender-based violence and improving learning outcome in Sierra Leone. But before that, I would like to share with you a brief demographic context of Sierra Leone, and followed by the key challenges faced by boys and girls in relation to access, quality, and well-being, focusing on gender inequalities and school-related gender-based violence. Okay, Sierra Leone is a small coastal nation, approximately 72,000 square kilometers, with 7.8 million people. And it might interest you to know that 58% of the Sierra Leonean population is living in the rural area, and we have 75% of the population under 35 years old. And if you look at the charts, you will see that 25% of them are over 35, and 44% under 15, and 31% are between 16 to 35 years. So according to the Human Development Index of 2020, Sierra Leone is ranked 182 out of the 189 countries. In terms of gender inequality, Sierra Leone is ranked 155 out of 162. The Safe Learning model is being implemented in one of the districts in Sierra Leone, which is Tonkolili district. And Tonkolili district is found in the northern region. And it's among the 5 poorest districts in the country. with 84% of its population living within less than $1 a day. Sonkolili is divided into 19 districts, and Concern is operating in almost all of those districts. So with this, we move to the key challenges faced by boys and girls in relation to access. Before the civil war in Sierra Leone, that was around the 90s, there was very low interest in education. So when the war came, it worsened the situation. So schools were burned, children were displaced. So there was no foundation for education in the country. But immediately after the war, we experienced a kind of rapid change in the system in terms of policy reform and development supports from development partners. So over the years, we have experienced an increase in enrollment in both primary and pre-primary. In fact, in the overall education system in the country. So since we are focusing on the primary, you will see that for the primary enrollment, we have 51% female and 49% male. So this tells you that we have achieved in terms of enrollment in the primary school. But this doesn't necessarily mean that there has been, improvement in the learning outcome. And this figure also tells you that there is high parity in terms of enrollment, okay? So as children are moving from one level of the education system to the other, then we start to see gender disparity in terms of enrollment, in which most of the girls, are likely to face challenges ranging from economic barriers, parental neglect, and negative cultural and gender norms. Also, because of the insurgents in school enrollment, we also noticed that there was a rapid growth in the existence of schools in the country. So before the war, we had limited number of schools, but immediately after the war, people saw the need for children's enrollment in schools. See, they were building schools in every community, in every society. So, but governments had limited resources to approve all of those schools. So you see that in 2018, we had like 49% of the school being approved, whilst in 2029, we have 79% of the school being approved. So within this period, we've seen the strength from the government to improve schools in terms of approval. And this has helped immensely in the quality of teaching. But when you go to most of the rural communities where these schools are not approved, then we have problem with quality of the learning. So now this takes us to quality. Like we've said already, in terms of quality, we still have a wide gender disparity in terms of quality in the learning, because we realize as children are moving from one level to the other, you find out that girls are likely to drop out because they are not getting the quality education they're supposed to get due to some of the barriers we've already highlighted. And also, we experience very low learning outcomes, and this has increased the disparity among boys and girls. There is no clear statistics in terms of the learning level for children now, but from the national examinations, we realize that the boys are doing better than the girls. Then also in terms of the availability of teachers, we have also succeeded in having a good number of teachers in the school, but the percentage of teachers that are untrained is a bit high. And even among those that are not trained or those that are trained, we still have most of them that do not meet the minimum requirements to teach the level they are supposed to teach. So this has also affected the learning outcomes in most of the schools greatly. Also, another big challenge with regards to quality is the average class size. So currently in most of the schools in Sierra Leone, we have an average class size of 60 pupils per teacher. This is greatly affecting the learning outcomes in terms of managing the classroom and ensuring that the learning resources are available for all kids. And in the process of even managing the huge number of pupils in the classes, we see schools trying to develop some makeshift, which creates a lot of well-being issue for the children in the schools, especially in the rural communities. So we move to well-being. Well-being has been a very major concern in the school system. Now, for most of the rural schools, we find out there are inadequate facilities and limited opportunities for children to learn. In most of the schools, they are makeshifts and they do not have proper sitting accommodation, and there are poor toilet facility as well. So this has made most of the children feel very unsafe and become disinterested in the learning environment. And also, there is limited female teacher in most of the schools. If you look at the current statistics, out of the total number of teachers, we have 28% female teachers and 72% male. This tells you that the teaching profession in Sierra Leone is highly dominated by men. And it's no secret that children, especially girls, they need female role models to confine in whenever they have problems. There are basic hygiene education that they need to have. So if you do not have female role model in schools, then there is every likelihood that the girl child is not feeling safe. Then also, the concept of using cane or corporal punishment is also very common in most of the schools in Sierra Leone. Yeah. So even though it's against the teacher's code of conduct, but we see teachers still using the cane to enforce learning. And this is even being supported by the parents themselves. As they normally say, if you spare the rod, you will spoil the child. So this has affected the learning outcome seriously and even increased the prevalence of school-related gender-based violence in the schools we operate. Moving to school-related gender-based violence. Research has proven that school-related gender-based violence has a very, very negative impact in the learning process. And in Sierra Leone, we have very limited data in terms of the prevalence of school-related gender-based violence. But according to a national survey conducted by a coalition of NGOs, including Concern on school-related gender-based violence in Sierra Leone, 9 out of 10 boys and girls in primary and secondary school face one form of school-related gender-based violence or physical violence once in their lifetime. And also, we have more than 50% of men and women who have faced one form of physical violence once in their lifetime. And we also have 11% of women who have faced sexual violence once in their lifetime. And these are mostly women and men within the age 15 to 49. And it's also good for you to realize that in Sierra Leone, we have limited data on the prevalence of gender-based violence among children. But a current statistic shared by Rainbow Center indicates that 70% of the young children are facing sexual abuse in the country. And also there is high prevalence of teenage pregnancy among girls. So when you look at the total number of our adolescent population in this country, we have 45% of them that are pregnant or have given birth by the time they get to 19 years. So this tells you the nature of the prevalence on school-related gender-based violence. Now we move to the safe learning model, and we want to see how this safe learning model works to address some of these situations. And the safe learning model is being implemented for 4 years, starting from 2017 to 2021. And it is implemented in Tonkolili district. Now, why the safe learning model? You might want to know why we bring this safe learning model. You know, school-related gender-based violence is very common in the context in which concern operates. And it has a negative effect on the lives of our children or the children we work with. So globally, there has been very limited research on how we address school-related gender-based violence or the relationship between school-related gender-based violence and learning. Concern has been working for a very long time on school-related gender-based violence, but we have not been seeing the impact we desire so far. So that is why we developed the safe learning model to address these challenges. Now we move to the model itself. So before the model, it is also important to know that Concern is using a holistic approach to address challenges in education, as our global education strategy shows how we understand the core values of access, quality, and well-being, and how these are related and very important in addressing the challenges in a holistic manner in education. So now we move to the safe learning model. So now what is this safe learning model? You know, Concern developed this safe learning model for a very long period of time in response to the global gap we identify in the education system. In the education system through a review of our program globally. And this is in line with our core values of access, quality, and well-being. So this is purely looking at how we reduce school-related gender-based violence, improving learning outcome through research. So the working assumption for this model is, children's educational progress will be enhanced when they live in a community that are underpinned by support for gender equality and children well-being. That is to say, if teachers are supported to implement the literacy intervention, then we will see children's literacy learning outcome improved. And if the children, the teachers, and the school management committees come together to address the root causes of school-related gender-based violence, then we will see literacy outcome improve as well as students' well-being. But what if the whole community is supportive of gender inequality and school-related gender-based violence? Then definitely we'll see an ultimate improvement in the overall school system of children. Now we move to the components of the safe learning model. The safe learning model is designed using different components, and these components have different activities so if any country want to adapt this same model, you can see that the model is being conceptualized. And in this concept, you have these activities. So the concept is the same, the activity might be different. So for literacy, you realize that in this package, the capacity of teachers are being built to provide the literacy intervention for pupils. Then for the second component, which is the school-related gender-based violence, the teachers, the school management committee, and the school club are being engaged. So in these ones, we engage children, the school management committee, and teachers to reflect on their attitude, norms, and practice in terms of school-related gender-based violence. Then at community level, we engage the SMCs, the parents, the community stakeholders, or we call them traditional leaders, in the form of community engagement to reflect on their practice in terms of addressing school-related gender-based violence in the communities. Then this takes us now to the approach concern is using to engage the whole community, focusing on the whole school approach. So in guidelines with the global school-related gender-based violence guidelines, so the SLM program is using the whole school approach to ensure that the entire socio-ecological approach is being considered, wherein the individual is targeted, the family is targeted, the school is targeted, the community is targeted, and the society as well. So in the next slide, and which is the final slide, you come to see how the various interventions in the safe learning model are interconnected and how they are transformative in approach. So, like I said earlier, we actually want to shift from that traditional knowledge or process-based approach in addressing SRGBV or gender-based violence. So the concern is now focusing on more on the transformative approach to ensure that the messages go across all the beneficiaries we are targeting to reinforce or to help change their perception or their behavior in terms of addressing attitude, norms, and practice. So you see that all the interventions are interlinked. So talking of the living peace, and in the living peace, we have the teachers, we have the community members generally, which they are couples. For the teachers and SMCs, they are also connected because in the process, we try to bring the school into the community and the community into the school. Then for the children, we engage in school clubs and social emotional learning for them to learn self-confidence, be resilient, and reflect on their behavior in terms of addressing school-related gender-based violence. And also, we also engage in community engagement or outreach to tackle the attitude of the wider community, as well as key community stakeholders in terms of changing their behavior and attitude. So this is it about the safe learning model. Thank you very much for your attention, and I hand you back to Bernadette for the next presentation.
Thanks so much, Abubakar. That was a fantastic overview of both the context in Sierra Leone, but then also of this program, which has so many layers and levels and elements that are interconnected both within the school, but then within the communities as well. So it leads in very nicely to Impul Mabenga from Sonke Gender Justice. She's the regional coordinator, and she's going to talk about the Sonke work and our partnership with Concern, which has really been kind of a really critical part of the transformative work. So I'm going to hand it over to you. Thanks.
Thank you so much, Bernadette, for handing over to me. And thank you to Abubakar for presenting such a lovely model. My name is Mpoboshe Mabena Lunga from Sonke Gender Justice, and I'm standing in on behalf of my colleague Nkonzo J. Kanyile, who leads up this amazing work that I'll be talking about today that was conducted in Sierra Leone. So I will begin by sharing a brief background about who Sonke Gender Justice is. So Sonke Gender Justice was established in the year 2006 as a human rights-based organization. And our vision is to have a world which women, children, men, and gender non-conforming individuals enjoy equitable, caring, and happy relationships that contribute to the development of a gender-just and democratic society that is free from poverty. So Sonke's focus is to strengthen government, civil society, and citizen capacity to support men and boys to take action, to promote gender equality, to prevent domestic and sexual violence, as well as to reduce the spread and impact of HIV and AIDS. And in this way, to contribute to social justice and the elimination of poverty. So what we believe in is that women are equals. We fully support gender equality and women's empowerment, and we believe that a more equal world benefits men, women, boys, and girls. It actually benefits everyone, if I may say. We also believe that for women, we need to be seen as, men need to be seen as part of the solution, sorry. And equality is only achievable if we, men, women, and everyone, if we work together. And also, we believe that working as allies with existing women's rights movements is also something that's quite necessary. Moving on again, Sonke believes in the gender transformational work, if I may say. So, for example, we believe that the gender transformational work must promote the rights of women and girls and link with efforts to empower them. That the gender transformational work must include and respond to diversities among men, such as sexual, ethnic, and class differences. We also believe that the gender transformational work must show the effects of gender norms and inequalities on men and women. And also, the gender transformational work must explore ways to transform gender relations by engaging both men and women. And also, lastly, for the gender transformational work to enhance the lives of boys and men and help them to actually see the benefits of why we need to do this gender transformation work. And then when I speak about why the need to engage men and boys, well, there's quite a number of reasons why we feel there's a need to engage men and boys. So, for example, we need to engage men and boys in that men have their own gendered vulnerabilities and their own specific health and social needs. And also, it's essential in fostering positive views, relationships, and behaviors among men from an early age. And also engaging men and boys creates space to confront patriarchal notions of what it is to be a man, for example, like looking at the root causes of gender inequality and the negative or risky masculinities that men tend to undertake. And also it's key to engage men and boys so that because it acknowledges the patriarchal notions again of power associated with being a man. And also, men are usually the missing part in the gender equation. We often see that a lot of engagements are usually with women, but we also see the need that men are missing, hence journey, then we could really have a just society. And also, lastly, the need to engage men and boys is, the harmful notions of masculinity undermine women's and men's and children's health, education, development, and economic empowerment, sorry. So changing the male gender norms will actually benefit, the society. Next slide, please. So now I am going to speak about the partnership that Concern Worldwide has with Sonke Gender Justice. So I'll speak on our strengthening capacity for the gender transformation programming that we had. And this was done ideally in 3 phases, which include the following. The first phase was an initial visit by Sonke, which brought staff through gender transformative workshops for them as individuals, so that we could assess the attitudes of the staff at concern. And then the second phase was really a return visit by Sonke to lead on a training of trainers with the education team that Abubakar spoke about, and to support the work with the teachers. And then the third phase was the return visit, which really included the monitoring and the practice and refresher trainings. So in essence, the partnership that we had was firstly around strengthening concerned staff capacity on the gender transformative programming. If we look at gender-related topics, you will agree with me that it's quite a complex topic that really requires one to be honest and open towards themselves, because we all have various views when it comes to gender transformation. And as such, what we then aimed to do was to start this process by assessing the attitudes of the concerned staff. I will share shortly the process that we used in order to do this. We also believe that in order to be a gender transformed champion or role model in the community, it really needs to begin by staff asking or taking a personal journey that requires one to reflect on their attitudes around several issues. For example, to reflect on their own gender norms, like what really is gender, what is gender equality, looking at things like stereotypes. I mean, we grow up in communities that label men as inferior, for example, or men as providers. But when we actually see the communities that we live in, women are also sole providers at the moment. We also had staff reflect on issues around power, around decision making, which also leads to discussions around shared responsibilities. And another area that we asked staff to reflect on was a topic of violence, which is quite an emotional journey. I mean, when one has to reflect, for example, on their own experiences of violence that they've had to encounter, be it violence that they've used themselves or the violence that was used against them. And also, lastly, we also engage staff with topics around enabling change, because at the end of the day, we really dream of living in a
Apologies, we have a frozen moment from South Africa. If we give it a moment, hopefully it will unfreeze.
transformative program.
Hi
So this
there.
process,
You froze for a minute or so, so it's great to have you back.
hello.
Hi there. Hi. We have you back.
Hi. Yes, I'm sorry about that. I think there's a technical glitch on my side, but I hope you can hear me now.
Yes, loud and clear. Thanks.
All right. So in a nutshell, I'll say Sonke's role was to support all of Concern's country program staff. And in this case, in Sierra Leone, it was to strengthen their capacity to do the gender transformative programming. This process is quite an important step because it makes one challenge their own attitudes and beliefs. And in the process, to try and get staff to be on the same level of understanding, I mean, in terms of values and the context, so as to have a unified voice when communicating or engaging in the community. Because you'll also agree with me that we all have different views about gender. So the nice thing about this process was that we were able to get the staff to be on the same level of understanding of what gender transformation is. So the other method that we did, which was quite useful for Sonke and Concern, was to really create time, to take the staff away from their usual work and put them in a safe space. And we did this by having a 14-day in-depth workshop. Yes, indeed, it was 14 days, which were quite intense, which was divided into, several sessions that were aimed to equip staff so that they could be able to interact with the community, so that they themselves could become role models to carry out these workshops by themselves. And then another mechanism that we used to get the staff was to get talking really about this personal journey that I've been speaking about, was through a manual that we developed, which is called Breaking the Barriers. So the manual has 3 modules which staff had to undertake, hence the 14 days that they had to go through. So in the photo, I don't know whether you can see the photo on your screen, you will see that this is one of the sessions in module 3 that was being done, which is a teach back session. So this is a session that is really towards the end of the workshop, when staff have really undergone their personal journey and will now be practicing on how they themselves would really, take the skills that they've learned in the training and go and practice them into the community. So ideally, the focus of this session was to make it quite practical for the staff before they go out into the community. So in short, I'll say this session really prepares the staff for the actual community implementation, and they would have to also review the gender sensitivity activities from the manual itself. And then the last phase of this whole session with the staff, we also held several follow-up remote support visits. These were quite structured and scheduled with the team that was involved in this program. And in terms of progress and challenges, we provided guidance on how to address these challenges, by, for example, doing country visits. We also went to see some of the sites where the team was working on, so that we could also, interact with the participants, which also gave us more time to give further guidance and support to the concerned staff on how to engage on several issues that they may face with the community. So for me, I would really say why this approach was so important is that it enabled staff to challenge their own attitudes, beliefs, and behaviors before they themselves could impact the community or beneficiaries. And this also ensured that staff are speaking at the same context in terms of, gender norms and, sharing experiences around the subject matter. Next slide, please. So now I am going to share with you some of the testimonials from the staff that we engaged with. I'm sure you will be moved and touched to hear some of these testimonials. So the first one, I quote, "The workshop impacted my attitude on how I facilitate both SRGBV related trainings and other work related trainings, which has improved me both professionally and personally." For us, it's something that was quite profound. This training, this personal journey really made the staff member really reflect on their own, journey, both professionally and personally. And if I move on to the next testimonial by another staff member, they said, I quote, "Gender roles are not fixed. Men should support the process of women's empowerment and reject gender stereotype beliefs." If you also look at this quote, it's something that's also quite powerful and profound, actually, for a staff member to say it. I mean, you also get the idea that if this staff member were to go out into the community, they would really create a lot of change. And then my last testimonial that I will share with you and leave you with for today to really reflect on was another staff member, and I quote, they said, "I will ensure to replicate what I learned from the training at my home and office. Gender norms are issues that are affecting the society, especially women. These trainings will help to increase transformational change in the communities." So again, you actually see the good aspect that came out from these trainings by the way that staff really reflected about how they felt about these trainings. So with that said, I want to hand over back to you, Bernadette, to lead us to the next speaker for today.
Okay. Thanks so much, and thanks for that really insightful perspective on the work of Sonke. And I think, as you brought across, the impact not just on our program participants, but the impact that it has on our staff and their families, and the ripple effects that has is really substantial. So yes, Shanine, welcome. And Shanine is the assistant professor in the School of Education in University College Dublin, and they are our research partner for the randomized control trial of the safe learning model. So over to you, Shanine. Thank you.
Thank you very much, Bernadette. I'm delighted to be here today to present on this really important research with you all. So my presentation is going to focus on the programme of research that University College Dublin are conducting to explore the impact of the safe learning model that has been presented by the previous presenters. And I'm talking today on behalf of the research team who are named here on the slide. And in this presentation, I'm going to give an overview of the research design and talk through some of the initial findings with reference to emerging gender issues. So globally, we know that there is very limited research in terms of what works to reduce school-related gender-based violence, or SRGBV. And we also don't know very much about the connection between SRGBV and children's learning. So the working assumption of the safe learning model is that children's educational progress will be enhanced when they live in communities that are underpinned by support for gender equality and children's well-being. And this assumption is what we are setting out to test through our evaluation of the safe learning model. And to do this, we've recruited 100 communities in one region of Sierra Leone. 25 of these communities are not receiving any aspect of the safe learning model, so they represent a control group. 25 are receiving the literacy intervention only, but none of the SRGBV components. At the next level of intervention, 25 communities are receiving the literacy intervention plus school level SRGBV inputs, which include the teacher training, the school management committees and school clubs. And then at the third level of intervention, there are 25 communities that are receiving the literacy intervention and full SRGBV, which includes the school level components that treatment 2 receive, plus a set of community level SRGBV inputs, which involves work with parents, work with community members, work with older children in the community, and also some health inputs. So we are going to examine trajectories in terms of children's literacy and wellbeing outcomes across each of these 4 groups. And in doing so, we'll be able to provide some initial evidence of the impact of the safe learning model and of these different inputs at these different levels on the children's literacy and wellbeing outcomes. And an important methodological point just to note here is that in order to be able to link any change in outcomes to the safe learning model, we want to be able to say that these 4 groups, these 4 treatment groups are roughly similar or balanced at baseline before the intervention begins. So to do that, we used a random allocation process in order to assign each of the 100 communities to one of the 4 groups. And that's the randomized control trial design that we're using. So we began the main trial with the 100 communities in October 2018. And just before this, during the 2017 to 18 school year, we conducted a smaller scale pilot study with 10 schools, and that was 5 intervention schools and 5 control schools. And we used this period to give us time to develop our measures, particularly the child wellbeing measure, which I'll describe later, as well as develop our recruitment and data collection procedures. And this pilot phase also allowed the implementation team in Sierra Leone the time to pilot the full model and identify any practical issues with integrating the different components of that model in practice. Then in October 2018, we worked with Concern and a local fieldwork team on the ground called Nest Builders International to recruit each of the schools and conduct our baseline data collection with Class 1 children, their teachers and school principals. We visited the schools a second time in May 2019 to collect follow-up data after 1 school year of implementation of the different components at the different levels. And this was when children were at the end of Class 1. We had intended to return to the schools a second time, or at the same time the following year in May 2020. But of course, with the pandemic, we had to postpone this because of the school closures and the travel restrictions in place. So this data collection instead took place in November 2020, when the children were at the beginning of Class 3. And we're currently preparing for our final wave of data collection, which will take place in May 2021. In relation to our data collection instruments, we are measuring reading attainment using the early grade reading assessment. We're also collecting data from school records on children's attendance in school, and we're asking the children to report on their experiences of violence and of gender equality in their school and community. We're measuring child wellbeing using a tool called the CAPSA, which I'll describe shortly. And we're also collecting in-depth qualitative data within 4 communities, and we've selected 1 community per trial arm. And this qualitative case study work involves interviews and observations in the school and in the community with children, teachers, and families. We're also using a method called photo voice, which involves the children taking photographs of, for example, places in their community where they feel safe or unsafe. And then we use these photographs as stimuli during the interviews. So I'll give a bit more detail about the CAPSA, the Child and Adolescent Personal and Social Assessment of Wellbeing. So we had to develop a measure specifically for use in this project. And to inform us in doing this, we conducted a review of the literature in order to identify any available self-report measures of child wellbeing that would be appropriate for use in this context. Because a lot of the existing literature and a lot of the measures that we were familiar with already were really based on Western understandings of wellbeing. So through our systematic search process, we identified 11 measures of child wellbeing that were used in low-income or humanitarian contexts. We then mapped the domains from these measures and then conducted focus groups with children and adults to really try and understand Indigenous perspectives of child wellbeing. We integrated our qualitative data with the mapping of the existing measures from our systematic review to construct a new measure, which we've called the CAPSA. And it includes 8 indicators of wellbeing, which you can see there on the screen, and we apply these across 4 domains: personal, peer, family, and teacher. In our analysis of the data so far, one gender difference that we've noted in relation to wellbeing is that females often report higher personal wellbeing. So that's girls that we've collected data on in the schools. When we drill down into the specific indicators where we've undertaken, which has illustrated how gender dynamics play out in the everyday lives of children in Sierra Leone. So we've seen here that constructs of masculinity draw on images of leadership and responsibility for decision making in the home and the community, whereas constructs of femininity were associated with the domestic sphere, obedience and receptiveness. We've also seen how gender impacted on opportunities for how well-being were structured, with female roles centering on domestic forms of caring for their families and male roles centered on providing economic resources to families and physical protection. There was also a tension between gender equality and beliefs about essential gender differences and the inevitability of structured gender inequalities, as the quote here from a father demonstrates. So the father says, any kind of way you look at it, boys and girls will never be the same. It's just like our fingers are not equal. It will always be a difference. We asked children about their daily lives, and one aspect of that was domestic work. So we asked children how often they do domestic work, and while both boys and girls reported doing chores at home, there was some indication of gendered labour division within the household, with a higher proportion of boys reporting that they never or seldom do work compared to girls, and 30% of girls reporting that highest frequency of doing chores morning, afternoon and weekends, compared to 18% of boys. And this also came up then in our qualitative data, which then showed how the gendered labour division had implications for girls' education. So here, one of the girls that were interviewed said, when day breaks, the girls sweep the compound, they fetch water, wash the dishes before they prepare themselves for school, and after school they will do the cooking at home. While the boys just fetch water in the mornings and then go to school, after school they just roam about, or some will rest for a while and then study. This pattern was also reflected in gendered This pattern was also reflected in gendered expectations for education, with lower expectations for girls evident in some of the data. Girls also had lower expectations for their own brilliance. We collected data on gender equality in school through children's perceptions of their teacher beliefs. And that's just on the next slide. So we saw a difference here in relation to brilliance, which came out very strongly in our qualitative data as a local term used to reflect competency. And across our whole sample, children were more likely to believe that their teachers felt that boys were brilliant, with much higher numbers reporting that compared to girls. We asked children about their experience of physical violence, and so far we haven't identified any significant difference between boys and girls in relation to physical violence from different members of the family or the community. And just finally, to end on a note in relation to some of the initial findings from the impact of the Safe Learning model. So teachers and head teachers that we've interviewed in the intervention communities have reported perceiving a positive impact of the supports from concern on several aspects of teaching and learning, such as classroom instruction, classroom management and classroom environment, which suggests that the intervention may be making a difference in the schools. Our analyses of the outcome data on wellbeing and literacy after 1 year of intervention show that outcomes have improved for children in communities assigned to intervention groups compared to the control group. And we're currently analysing the quantitative data from the second wave, which was collected in November 2020, to establish whether that trend persists after 2 years of implementation. So we look forward to updating you all on the findings in due course.
Great, thanks, Janine, for that. I think it's great that we have you on board, and that we're gathering such kind of rich richness and rigorous data. It's really fascinating, the stories that are unfolding, and not just the quantitative, but that richness of qualitative data, which is so important in understanding issues around gender dynamics and equality are not so easily put into numbers. So it's exciting that as we wait for the kind of final results from you. Thanks everybody for bearing with us, and I know we had a slightly late start. Just in terms of the questions that are coming up, we have one here which is to Abu Bakar. If you could share any insights on how the teachers responded to the program. Yeah.
Thank you, Bernadette. The response of the teachers is quite positive so far, because they see the program as a community-driven program, wherein the skill that are being transferred to these teachers are teacher-friendly and as well as people-friendly. So as we've seen from the statistics I shared, we have a huge number of untrained and unqualified teachers. So, and even the trained and qualified teacher, they lack most of the basic skills in teaching the foundations of literacy. So when we introduce our literacy intervention, they see it as a solution to the problem, the current problem in addressing, the learning outcomes. So they actually appreciate the program. And as I tell you, the community of practice we've established in the communities through the learning cycles, the teacher learning cycles, it's still going on without even the direct support of concern as I speak, because they see it as an experience sharing opportunity, and it helps to build their capacity in their own ways.
Okay, and in terms of the training that was kind of looking at kind of attitudes and gender norms and that side of things, which might have been newer to what we were already doing around literacy, how did they take to that? How did they respond to that?
Well, the literacy intervention is not only focusing on the foundations of literacy, but we also include some competency-based aspects, which addresses the issue of managing classroom and planning lesson. Before now, the way teachers, are teaching is a kind of, gender stereotype, wherein they think the boys are more clever than the girls. So most questions are being directed to girls, to boys. So now we see the kind of, child-centered approach being used, where questions are being, disseminated among boys and girls, and encouraging girls to take more responsibility in terms of the learning process in the school. So that one is happening as we speak. And even for some of the sessions we established for the children, for example, the social and learning, social and emotional learning. So it's an opportunity for these children to develop some social skills that will help them to interact very well in the school. So that has even helped to improve the girls in terms of thinking that they are, lower than the boys. So that gender, disparity has been breached so far through the literacy intervention.
Okay, thanks. Shanine, for you, there's a question in relation to ethics. Sorry. If you could share a little bit about how you manage the ethical considerations of collecting such sensitive data information related to SRGBV from such a young group of children.
Well, that was a really key consideration for us at the beginning of the study, and actually all the way through. But at the beginning, we had to apply for ethical approval from UCD. And one of the concerns that would have been raised there is around, when you collect data about harm relating to children, then if you're gathering this information, then as researchers, you have a responsibility to act on it if a child discloses something. So by asking about it, we are putting children in a position of disclosing information that we would then have to act on. So child protection concerns are part of the training that we do with the team of field workers in Sierra Leone. We do that every year. We have a protocol in place that we developed with concern at the beginning, whereby if there are, through data collection, if it emerges that a child is exposed to levels of violence that would be beyond the sort of cultural norm, then we record that and we report that back to concern so that there can be a follow-up locally. So that's how we've handled that in terms of our ethical procedures.
I'm actually fascinated by your photo, what do you call it? Photo voice initiative. Can you tell us a bit more about that? It sounds really interesting.
Yep, of course. Well, basically, it's a method that has been used in lots of other projects. You know, I'm not sure how often or how much it would have been used in the Sierra Leonean context or in Africa in general, but we've certainly used it in very participatory research projects. I suppose where it comes into its own with children is that quite often it can be very intimidating for children, and especially young children, to be interviewed by a researcher or to discuss with a researcher. And really what I think the benefit of using something like Photo Voice is that it puts the children in the driver's seat in terms of what's going to be discussed in the interview, because it's based on their photographs. So things that they've chosen to take photographs of that are meaningful to them. So really they are driving the conversation, and that's a real a way to break down barriers in terms of power relationships or power differentials between a researcher and a research participant, whatever age they are, but we're particularly cognizant of it when our children or when our participants are children. So we weren't sure how well it would work initially. We weren't sure whether the children would be comfortable or happy using photographs, but it's worked really, really well so far. The children have taken really fascinating photographs, but what we're learning is that it's not so much the photograph that is important or meaningful. I mean, it is meaningful, but it's the discussion that happens about the photograph that really explains to us what it's about. Because quite often we can look at a photograph and interpret it in one way, but we always have to ground it in the child's interpretation and explanation of what that photograph, the content of it, means to them.
Yeah. No, it sounds absolutely fascinating, and like you say, it's like you're giving power to them, you know, to kind of lead the discussion as opposed to the other way around. Yeah, I can only imagine the initial reactions of kids, you know, being given these cameras to go off and do. I'm sure they take a few extra photos. But yeah, brilliant. Another question in relation to so the engagement with parents, Abu Bakr, just to know more about how you engage the parents of the students and how they responded. And I guess this is your, you know, living piece. And how did that go down? How was that received, and how did it go?
Yeah, all right. So I guess you might have learned how the various components are interrelated. So for the engagement with parents, we have like different sessions. We engage them. One is the living peace.
Yeah.
Second is the school management committees, because most of these members, if all of these members are parents of the children in the schools. Then also on the community conversation session we have. So like for the living peace, we actually want to see how we address, you know, issues of, you know, managing the home, you know, managing issues that affect the home and that in turn might affect the child even from going to school, you know. So we engage those couples of the children through a structured conversation we call living peace session. Then also the SMC members, before now, there was no connection between the school and the community. So we had to restructure that community structure we call school management committee to see how best the community could feed into the school and also the school feed into the community. So mostly the composition are parents of those children that are attending. So in those sessions, mostly the schools are giving feedback to the school management committee in terms of how kids are learning, And they also, in turn, share responsibility in terms of how they support the school to manage the school, especially when it comes to teachers' management, because most of them, they are untrained and unqualified, so in effect, they are not paid. Then also, there is a wider community engagement we call community conversation. So in this, we don't only focus on addressing, gender norms. We also look at the challenges associated to the school, especially with regards to, supporting children's learning. So before now, there was that attitude among parents that government is providing all the resources for children to learn, so they barely provide the basic book for those children. So through this engagement, they have seen the need for them to take the responsibility to continue to support. So we've seen, real changes in terms of, parents taking responsibility for their children's learning in the communities.
You're on mute, Bernadette. You're on mute.
Charlene, do you want to jump in, or you're just telling me I was on mute?
Oh yeah, no, I was on mute. Or sorry, Bernadette, yes, you're on mute.
Thanks. No, sorry, I was just asking a clarifying question in terms of, are we seeing changes in attitudes and behaviors of the parents generally in terms of, gender norms and within the household, and how people are behaving, and, if there's changes and shifts happening?
Is that one for me, Bernadette?
Yeah, sorry, Abubakar, that's for you.
Oh, all right. Yes, there has been changes, yes, because before now we realized that most of the parents prioritize their economic activity over their kids' learning. Mostly kids do not attend school regularly, and even for those who attend regularly, mostly they go to school very late, and we've seen, even parents taking the girl child for other activities, including early marriages. But through our engagement, they have seen the need for girls, especially girls, to be in the school. And even the issue of corporal punishment in the home has been reduced because we introduced to them some of the gender laws, especially relating to how we handle or support children. And also there has been huge sense of violence in those households in terms of, the male feeling domineering over the female, and that affects the children in the household. So because of the Living Peace engagement, we've seen some level of peace, and there has been tight correlation in terms of supporting the children's learning. So in terms of gender norms, we've seen some changes. I cannot say it has improved overall, but there are changes because we see even now in terms of roles and responsibility, we see now the boys are more taking now, girls' role as opposed to the previous time.
Some shifts and changes. Great.
Yeah.
Great. Thanks, Abubakar. Impo, just in terms of, gender transformative processes, what from your experience, is like the key to bringing that about? I'm sure there's been challenges, with our own staff in terms of the processes that people have to go through. So just from your perspective, what are those kind of challenges, and how do we overcome them?
Thanks, Bernadette. I think when it comes to gender transformation, it's quite difficult. If I can use the English saying, I hope I'll get it right. It's difficult to teach an old horse. Yeah, something along those lines. So I think for us, getting this message or transformation, especially for older people, tends to be quite difficult compared to if it's young people from, you know, school going ages. That's one of the challenges that we've had. And you also look at issues around, you know, we live in cultural and religious communities where, you know, patriarchal values are really, you know, the theme of the day. So for us, when we speak about transformation, it really takes a lot of energy and effort for people to really start getting the idea of how to, you know, go about it. But I think one of the ways that we've maneuvered around it is to show men the benefits that come with gender transformation, for example. So, for example, we'll say that if you as a man spend more time with your wife, helping around the house, helping with the children, it means your wife has more time to rest. It means she gets a lot of energy. You have enough bonding time with your family and your children. And maybe another, you know, challenge really is the lack of good role models in our communities who, you know, as men present that gender transformative approach. Again, it goes back to how we were raised culturally, you know, that for a man you can't be seen, for example, washing clothes and all. So there's quite a number really of challenges, but I think the constant engagements that we do, I mean, like, for example, with the concern stuff, where we really had to go through a journey of engaging them and speaking to them to reflect on some of these fears, because at times you find that for someone, it's not really about them not wanting to change, but it's just the fear of what will the community say, what will my colleagues say if I seem to be a transformed man or a transformed woman. So these constant discussions and honestly discussions, they've really, really helped out, because you also get to reflect on yourself as to what is it that I really need to do? I mean, what do I need to change? And you also link it to, for example, if you bring in the issue of children for the next generation, to say, as a man, would you really want your son to grow up in a society where they are abusing women? And you usually find that the men would say no. If I look at my daughter, I wouldn't want my daughter to grow up suffering, having to do a lot of house chores. So for me, these are some of the ways that we've managed to engage participants or other communities on how to really break through into the gender transformative work. It's not easy, and I'm sure we all agree that when it comes to change, it takes a lot of time. It may not be in our lifetime, but we do really have hope. I mean, even having such forums to discuss these issues, for me, it really brings hope that there is hope. One day we will achieve the fruits that we are working on at the moment. Yeah.
No, absolutely. And I do think um, we are seeing change, and I'm really hopeful that, you know, things can happen and we can see a lot in our lifetime. Okay, maybe not everything. But
Yes.
you know, it is quite amazing the shifts and changes that have happened after just even a series of trainings, you know, amongst our staff. And so, you know, not everybody, but some will. The early adopters and some of the others will follow. So thanks for that. And thanks everybody for your amazing contributions to Abu Bakar, to Shanine and to Impo. And it's been quite a full discussion around the whole model and approach. And I suppose, I know we all understand the importance of, you know, the work that's done within schools, but I think what the model is showing is, like, it's so important where children are living and being socialized at home and in the wider community, that we also engage there with parents and with community leaders to try and deepen those opportunities and shift those rigid gender norms which impact ultimately on children's learning outcomes and on issues of gender-based violence. So let's see, the model continues, the research continues, and watch this space. If you're interested in the research papers, go to just Google Concern Insights, and you can find all the education research papers to do with the model there, and feel free to contact us. So I think that's about it. Thanks to everybody. Again, huge apologies for our technical glitches, but glad we could come here in the end. Okay, bye-bye. Have a great day.